President Trump says he would like to see states work to open schools and says he will not consider states open unless they open their schools. The president made those comments during a meeting with the governors of Colorado and North Dakota at the White House Wednesday. Mr. Trump also appeared to criticize the nation's top infectious disease expert, Dr. Anthony Fauci. While testifying before a Senate panel Tuesday, Dr. Fauci said it was dangerous for states to reopen before infection rates drop. He also said a vaccine will not be ready in time for the fall semester. President Trump says he was surprised by Fauci's comments.
I was surprised by his answer, actually, because, it's just, to me, it's not an acceptable answer, especially when it comes to schools. The only thing that would be acceptable, as I said, is professors, teachers, etc., over a certain age. I think they ought to take it easy for another few weeks, 5 weeks, 4 weeks, who knows, whatever it may be. But I think they have to be careful because this is a disease that attacks age and it attacks health. And if you have a heart problem, if you have diabetes, if you're a certain age, it's certainly much more dangerous. But with the young children, and students, it's just take a look at the statistics. It's pretty amazing.
Nancy Cortez and Hunter Walker join me now. Nancy is our CBS News chief congressional correspondent, and Hunter is a White House correspondent for Yahoo News. Welcome to you both. Nancy, I'd like to start with you. Interesting to hear that the president is saying schools should reopen because you covered that Senate panel hearing yesterday where Dr. Anthony Fauci, the nation's top infectious disease expert, said that there is this emerging syndrome among children that we don't know a lot about. And he also discussed the fact that there's not going to be a vaccine likely in the fall of this year. Tell us what else top health officials are saying about that.
Well, Fauci wanted to clarify during the hearing that he wasn't saying that schools point blank shouldn't reopen just because a vaccine won't be ready in time for the fall semester. But he did urge caution, as you say, Elaine. He said it should depend on the outbreak level in various areas of the country. And some of his colleagues in that hearing, other witnesses who were on the task force, did note that while a vaccine won't be ready in time for the fall semester, the U.S. capacity for testing should be far larger by then than it is now. Dr. Robert Redfield, who heads the CDC, said that the U.S. may be able to administer as many as 40 million tests a month by then, which would enable schools to do a lot more testing, giving students and their parents more of a sense of security that if individuals are positive for the coronavirus, they can be removed from the school population more quickly. But at the end of the day, Fauci was somewhat agnostic on that basic question, should kids go back to school in the fall or not? We know that some schools aren't waiting to make up their minds. We just heard a short time ago, for example, that Harvard Medical School is telling its incoming students not to come to Boston for the start of the fall semester. They will start online. A big chain of universities in California also announcing that its fall semester will start out online. So some schools are making a decision now that they're not going to wait to see if there is a surge in cases in the fall. They're going to go ahead and make that decision now.
Well, the Associated Press reports that it obtained a 63-page document written by the Centers for Disease Control and Prevention. It provided guidance on how to reopen businesses and other institutions, but the White House reportedly shelved this plan. Hunter, are the White House and top health officials in agreement on how to best go about reopening?
A couple reports recently that indicate a little bit of tension between the White House and the CDC. In the past few days, there was also a USA Today report indicating that the CDC had some kind of dispute with the president's chief of staff, Mark Meadows, about potential procedures for screenings at the airlines. with one of the CDC officials emailing that, he felt like just doing temperature screenings was a fig leaf and didn't want to see the White House go in that direction. So clearly, with the president talking about this transition to greatness reopening plan, we're seeing a lot of urgency and focus from the White House on that. And, the scientists are definitely urging a bit more of a cautious approach.
And Nancy, you reported on an unreleased report from FEMA, which found surging infection rates in some parts of the country earlier this month. How are the administration's top health experts and lawmakers reacting?
Well, they haven't been asked specifically about that report, but Fauci did make an offhand comment in the hearing yesterday about the fact that we're already seeing spikes in areas around the country. And he warned, of course, that those spikes will become much more common if states begin to reopen before cases have started to drop over a 14-day period. And he argued that states are going to need to be prepared for those spikes, that they should know those spikes are going to happen. They should be ready to do contact tracing. They should be ready to ramp up their testing if needed, if they're going to continue to reopen their economies, reopen businesses in defiance of federal guidelines, which, frankly, at this point, most states seem to be ignoring.
Well, I want to turn to reports that the White House is pushing the CDC to revise its coronavirus death toll. Hunter, what are you hearing about that? Why would the White House pursue that?
Well, the reporting, which came from the Daily Beast, is that Dr. Birx, one of the president's top coronavirus task force advisors, was basically trying to use a different type of category which would present a lower death toll. I mean, I think it's pretty clear when you see the president, stand in the Rose Garden flanked with these signs touting his performance on testing, that the White House is somewhat self-conscious about any impression that the coronavirus response has been lax. And that obviously makes sense. I mean, we're looking at really one of the largest and most deadliest catastrophes in American history. And of course, it is an election year, and that's never far from the president's mind.
Well, Nancy, Dr. Rick Bright, a whistleblower and former top government virologist who was working on combating COVID-19, is set to testify before the House Thursday. What will you be watching for?
Well, we're going to hear from him really in an extended session for the first time. He has done an interview with Norah O'Donnell, but now he is going to be grilled by Democrats and Republicans about his whistleblower case, his claim that he was removed as the head of this organization that is focused on identifying and developing vaccines in situations just like this one, because he claims he was not willing to go along with some of the cures and treatments that the president was touting, like chloroquine, that Dr. Bright felt were unproven and potentially dangerous. So he says that it was a case of retaliation, while the Department of Health and Human Services insists that he was simply moved to another job at the National Institutes of Health that also had a great deal of responsibility. So we'll have our first opportunity to hear from Bright in this extended setting. He'll really have the spotlight all to himself. He's the only person testifying before this committee. And then we will see both Democrats and Republicans ask him questions about what he was told, why he believes that he was retaliated against, and whether there could have been any other reason for him to be removed from that position at this very sensitive time.
And Nancy, the House is expected to vote on Friday on Democrats' $3 trillion HEROES Act. Republicans have made clear they do not support this. What appetite is there on Capitol Hill for another massive stimulus package?
Well, there is a very large appetite among Democrats, and that's why this bill probably will pass in the House with Democratic support and Democratic support alone. In fact, there are some progressives who are frustrated that the bill didn't include even more of their priorities, and they don't even want to vote this week. They want to have a little more time to tinker around the edges. So Democrats are making the case that this is an unprecedented situation, and it calls for unprecedented unprecedented assistance to state and local governments, to unemployed Americans, to low-income Americans who need more food assistance, and on, to workers on the front line who they say should get hazard pay. But Republicans in the House and in the Senate are arguing that this bill is not going to go anywhere, A, because they say it's too expensive, and B, because they say it's premature. They argue that all the money that they have issued to states and local governments in the first couple of rounds of spending haven't all gone out the door yet. They want to see what the need is after the states and local governments start using that money. They also want to see what states and local governments use the money before they start issuing more money. And so Republicans are really pumping the brakes here. So the question is, what happens after the House passes this bill on Friday, if that is indeed what happens? Do Senate Republicans engage with Democrats right away, or do they let that package kind of sit out there for a while and see how the public reacts?
Well, we saw Dr. Anthony Fauci clash with some Republican lawmakers during that Senate hearing on Tuesday. Senate Majority Leader Mitch McConnell said that Americans could listen to Fauci's public health advice and the president's economic message at the same time. Nancy, walk us through this recent messaging that we have been hearing from GOP lawmakers.
So I would say that watching that entire hearing yesterday, Fauci's message was received with either support or equanimity from virtually all of the Republicans on the committee, except for Rand Paul of Kentucky, who argued that Fauci was being too cautious, that there might not be any surge in the fall, that all the models had been wrong, and that basically that Fauci's prescription was that no one should go back to work and no one should go back to school. Fauci pushed back and said that's not what he was arguing, but that he was arguing for caution because there's so much about this pandemic that we still don't know. Other than Rand Paul, however, most Republicans seemed very comfortable with both the medical advice that was being delivered by Fauci and also his interpretation of the spikes that we've seen around the country and what he predicts for the fall and going forward. And so there is always going to be, and Fauci acknowledged this himself, this tension between public health, keeping everyone safe, and the need to keep the economy from collapse, keep more people from losing their jobs. And I think that that's a tension that everyone on both sides is highly aware of. Where they come down on that continuum, really varies based on their point of view, where they're from, how bad the outbreak is in their state, and the like.
Hunter, we had become accustomed for a while there to seeing Dr. Fauci, Dr. Birx, other members of the White House Coronavirus Task Force on a near daily basis during those briefings. Those aren't happening now, and I wonder, what is the task force doing as the White House shifts its focus to reopening?
Well, there were initial reports that were basically generated from comments the vice president made himself that the task force was being disbanded. The president pretty quickly pushed back on that after a backlash. So it's not entirely clear, but as we've been saying, it is clear that the White House really does seem to have moved its focus and its energy towards reopening. There's always been indications that Jared Kushner has been sort of running what some folks have termed a shadow task force in the background. So, I think that the task force is providing advice, but as there is this tension between the scientists and those who are more focused on the economy, it is being marginalized at the very least.
And Hunter, we saw the president in the Rose Garden earlier this week say that the country has prevailed when it came to testing. Is there a sense that the administration's strategy to push past the pandemic is working?
Well, first off, it's not working within the White House, right? We've seen growing instances of a bit of a coronavirus outbreak there with the vice president's press secretary Katie Miller testing positive, this valet who was reportedly very close to the president. My colleague and I have reported there were at least 11 active cases within the Secret Service. And this is all happening as NYU has come out and said that these Abbott rapid tests that were used at the White House complex may not be entirely accurate. So, they're having a little trouble containing this in their own backyard. And when it comes to the national testing picture, they're playing a little bit fast and loose with the numbers. They're very fond of saying that we have more testing than any country. But obviously, America is one of the biggest countries in the world with over 320 million people. There are multiple jurisdictions that have done more testing per capita than us. There's several jurisdictions, several countries that have much, much lower death rates than we do. Part of the reason we've passed some countries like South Korea in per capita testing is that we haven't necessarily gotten the death rate down. So, they're touting this, but there's a lot of holes in it.
Right, and some people, have noted that the push for testing, in their view, had it come weeks earlier, months earlier here in the U.S., that curve that we've been seeing would have been flattened in a significant way earlier on. All right, Nancy Cordes and Hunter Walker for us. Thank you very much. Good to see you both.